a state-of-the-art sports medicine and orthopedics practice in Skaneateles.
So I'm an orthopedic surgeon. That means that I perform surgeries, but most people don't want surgery if they can help it, and that includes myself. So we always try to get patients better without having to do surgery first. Certainly it comes down to surgery sometimes, but most of the patients that I see, most of the problems I see, do not need surgery. Hold your arms up like this, as strong as you can.
Dr. PIETROPAOLI founded this practice after studying with Dr. James Andrews, the legendary orthopedic surgeon who has worked with dozens of elite college and professional athletes.
Basically, I got my model of how to treat patients from my sports medicine fellowship with Dr. Andrews. He was very integrated with the physical therapist, the athletic trainers, the coaches, the parents, and had a lot of support staff around him. So I kind of wanted to model my practice similarly as an integrated healthcare system.
There are highly trained physical therapists, nurses, and the practice even has its own open MRI and X-ray machines. This is the latest high-tech tool in the team's arsenal, MLS laser therapy. It's a revolutionary technology that reduces inflammation and alleviates pain.
Basically, what sold me on it was I tried it on myself. I had a strain of my calf muscle. I also had some tennis elbow. And within a few visits, I was already feeling better. And I knew that standard treatment, it took a lot longer than that. So that helped sell me. And then we just started using it on patients.
When we started using it with patients, it was miraculous, really. The benefit that is obtained without pain, without any considerable side effects.
Patients have generally been thrilled.
I was in a car accident years ago, and over the course of years, the x-rays have been telling me that, that I have arthritis in my neck. And it got to the point a year ago where my head started stiffening up, and I had really a lot of pain in the back of my neck. And I came here and I was like so surprised with the results of it. Like I noticed it immediately. I'm back to a lot of physical labor jobs that I do, weightlifting, running, and it hasn't bothered me since. So it was great for me.
My knees started to bother me, and when I sit down, I have a hard time getting out of a chair, and my knees would crack. I was afraid I was going to be in a wheelchair. In fact, the VA wanted me to have one of those dollies you push around, and I told them no. I just couldn't walk decent. I fell down 3 or 4 times, and I was really in bad shape. Now, I'm still lame, but I don't have the pain I had. That makes it a lot easier to walk and everything.
What's probably been causing most of my discomfort and lack of range of motion is scar tissue in the joint. It helps to break up some of the scar tissue. So I've seen reduced inflammation in my ankle. It really felt like things were starting to open up and kind of tear apart inside my ankle, the scar tissue, so my range of motion got a lot better after having the laser.
Tom had a pretty significant hamstring tear. When he came in, the entire back of his thigh was black and purple, pretty decent sized hematoma. Within the first 2 to 3 treatments, the coloration and size of the hematoma had significantly reduced by at least 50%. By the end of his 6th treatment, it was completely cleared up.
I've seen people that have had pain in an area for years as runners, and then they do the laser and they're 100% better after 4 treatments. That to me has been one of the most astonishing results I've seen with the laser so far.
Your body generally does a pretty good job of fixing itself. That's what it's intended to do. So sometimes, you know, things for whatever reason don't follow that normal course, and then you come in to see us, and you know, prior to maybe it was an injection or a surgery or rehab, and life was good. Now we have another kind of mode of fixing people, you know, being non-invasive with no known side effects seems to be something that people appreciate. So instead of having getting poked with needles or cut open, they can sit there for 15 minutes and get the light energy and are able to feel better as a result.
I tore my bicep at work. The laser seems to be healing. So I could tell from the first couple appointments that it seems to be slowly improving over time. So.
We have a lot of patients who are afraid of needles. They don't want surgery, and they are just ecstatic when they find out there's a non-invasive method that can actually make your body heal itself. We're not putting anything artificial into the patient. We're not putting any shots. We're not doing anything invasive. It's your body being stimulated by the laser to heal itself. So when you get better, you've actually healed yourself.
People come in as a last resort. Sometimes they've had surgery, they've tried the injections, they've done it all, and they're just amazed at the results that they get with laser therapy.
The most advanced sports medicine and orthopedics practice in the area now has another tool to help patients, and it fits right in with the team's overriding philosophy.
Anytime you can do something that doesn't require a medication, it doesn't require any needles, any shots, any surgery, it's non-invasive, patients are going to immediately perk up.
I just have been thrilled with the fact that we have another option for patients, and it's a tremendous adjunct to what other treatments we've had available. And I think we're probably just at the tip of the iceberg in terms of what uses it's going to have in the next decade or so.